for Elmwood Transcona.
Thank you very much, Madam Speaker. And here we find ourselves again debating some of the financial measures that are necessary in order to help Canadians cope with what has, inarguably been one of the most difficult public health and economic challenges of our time. So, I mean, in terms of response, I have to say, Madam Speaker, although there isn't anything objectionable about the measures proposed in the bill, I do think that it's missing a really important and significant opportunity to make some much needed headway on issues that Canadians are facing that are part and parcel of the employment insurance system, and that there's a well-established general support for in the House of Commons. So I'm going to speak to that very shortly, but I do also want to recognize that, when we talk about the pandemic and its effect, that we all know, and it's been said many times today on International Women's Day, that it has had a disproportionately negative effect on women across the country for all sorts of reasons, because women do a disproportionate amount of the caregiving work in families. We've seen women step back from the workforce above and beyond the simple amount that might have taken place due to job loss in the economy, because they're shouldering the brunt of a lot of the care work that's been required to happen, particularly when schools are closed and there's and access to childcare has been difficult. That's had a disproportionate impact on women's ability to participate in the workforce. So those are things that we need to be mindful of as we move towards a recovery, but there are also things that we need to be mindful of as we discuss the measures that are in this bill and the measures that are not in the bill that ought to have been. And so, we see in this bill an extension of the EI regular benefits to 50 weeks, which is something that makes sense. We know that the economic consequences of the pandemic are far from over, and that people who have been requiring exceptional financial support are in many cases going to continue to require that kind of support on an extended basis. It is curious to note that the 50 weeks of EI was not matched in the government's announcement for extensions of the Canada Recovery Benefit and other like benefits up to the 50-week mark. And I think that does raise some questions in terms of how long the government is anticipating that these economic circumstances are going to last. And it would be nice to hear at some point why it is that the government didn't see fit to extend the Canada Recovery Benefit up to 50 weeks starting now, leaving Canadians who are dependent on that benefit to wonder whether that help will be there for them when the next round of extensions run out or not. And of course, the other thing that this bill does is to end the ability of Canadians to use the Canada Recovery Sickness Benefit, or what's could have been known as the Sick Day Program, in order to self-isolate upon their return from non-essential travel. Something that really, was not foreseen in the establishment of this benefit. Something that wouldn't have happened had the government gone ahead with what New Democrats believe is really the right way to do this, which is to legislate 10 paid sick days for workers across the country. Now, the federal government isn't able to do that for over 80% of workers in the workforce, as members here I'm sure all know. It is most workers fall under provincial jurisdiction, but I think the government could have shown leadership by doing that within the federal sphere. And I think they could have, made headway by sitting down with provincial premiers and pushing very hard on this matter as an appropriate way to make sure that Canadians have the resources that they need in order to be able to stay home and protect their co-workers and their communities from COVID-19. So we haven't seen that degree of leadership. I think that's regrettable. I think that would have been better, and it would have been much harder to abuse in the way that we found the Canada Recovery Sickness Benefit being abused for the purpose of allowing people to stay home after non-essential travel. And I think it's important to say to any Canadians that may be listening that to beseech them to follow those travel advisories, and if they don't have an essential reason for travel, to stay home. particularly in light of the fact that it seems, as we've known for some time, government has taken a while getting around to it, unfortunately, but there is widespread support within Parliament in order to see this program changed and to prevent Canadians from using it in that way. And so, if Canadians are going to embark on any ill-advised travel, they really should be doing their homework and understanding that the rules can change very quickly, and build that as best they can into their travel plans. And if they feel that there's any important uncertainty in that plan that they can't resolve, to make the choice to stay home. So I want to talk a little bit now, Madam Speaker, about what's missing in this package of reforms, because there are some things. And I have to say, I'm going to be honest with you, Madam Speaker, I was a little frustrated and in fact outraged by some comments from the Minister for Employment, Workforce Development, and her Parliamentary Secretary, who said that the idea of this bill was just to deal with some urgent matters. And I put it to them: go ahead and talk to Canadians who are suffering from cancer that are at the end of their 15 weeks of EI sickness benefit. Go ahead and talk to people who have had COVID and it's not leaving them. Maybe they're not in hospital, they're not in intensive care, but they have recurring symptoms and a condition that's coming to be known as long COVID. They're not able to look for work because they go through periodic episodes of chronic fatigue and other symptoms, trouble breathing. And it's occurring often enough that they know they're not going to be able to hold down a job, but their EI sickness benefit is done. There's no other program. Private insurers don't all recognize long COVID because it's a relatively new condition, and they don't have the resources that they need in order to be able to look after their families and themselves and maintain their financial wherewithal while they're dealing with a serious sickness. And the answer for those people, as it was for 15 weeks, would be an extended EI sickness benefit. Now, that's not so. I put to you, Madam Speaker, the urgency is absolutely there. Well, they said simple reforms and urgent reforms. There's nothing more simple than changing the number of benefit weeks in the Employment Insurance Act. There's nothing more simple than that. You change a 15 to a 50, and it's done. You couldn't ask for a more simple legislative reform if you tried. So the idea that this isn't simple is false. The idea that it isn't urgent is false. The idea that it isn't related to the pandemic is false. There's absolutely no good reason whatsoever to have omitted this. Well, let's look at the politics of the situation, Madam Speaker. The politics of the situation don't stand in the way either. 2 times, this very House of Commons in this Parliament has called on the government to extend the EI sickness benefit from 15 weeks to 50 weeks, 2 times. Once by majority vote on a motion, and the second time by unanimous consent, which is to say, Madam Speaker, that nobody out of the 338 members elected to this House objected, because if they had, that motion would not have passed. So 2 times, once by majority, once by unanimous consent, we've seen this House call on the government to extend the EI sickness benefit to 50 weeks. Now, is this something that the government has a principled objection to? Apparently not, because they themselves committed to extending the EI sickness benefit in the last campaign. Now, they don't go far enough. They didn't commit to 50 weeks. They committed to 26. But they have had ample occasions to make good on that election commitment in the context of a House of Commons that wants it to go even further than their own election commitment. The Liberals are the laggards when it comes to extending the EI sickness benefit. They're the ones that want the least amount of extension, and yet they won't even extend the benefits to the amount that they themselves promised, despite Canada and Canadians going through an enormously difficult time when the EI sickness benefit could be an important tool that helps keep sick Canadians going financially for a little bit longer. And here we see an acknowledgement of those difficult circumstances with an extension of up to 50 weeks of the regular benefit. That's the right thing to do, but it's also the right thing to do when it comes to the EI sickness benefit. And we have not had anything approaching an adequate explanation as to why the government is so dead set opposed to actually getting this done. I don't know if it's just because they want to campaign on it again. It worked well the first time, so let's keep it around for another election commitment. I don't know if it's in keeping with another theme that I've discerned in my time negotiating across the table with the Liberal government during the pandemic, which is that they are very reticent to do anything that would be a benefit that lasts beyond the pandemic. Whether we talk about the sick day benefit, that is set up in a way, and I'm going to talk a little bit about that shortly. There are some problems with that benefit. All of them stem from the fact that the government is resisting making sick days permanent. They want a benefit that will die with the pandemic rather than having something that will go on past it as a permanent and positive change for Canadian workers. And we're seeing the same thing here with the EI sick benefit that really ought to be extended on a permanent basis. Not my opinion, the unanimous opinion of the House of Commons, Madam Speaker. So let us not say that this is somehow just a partisan issue or something like that. So, you know, I don't know what it is, but unfortunately, there's not a lot of charitable explanations that one can draw. Maybe it's that they want to keep it for an election commitment. Maybe it's that they just don't want any good permanent changes emerging from the pandemic. I suspect we would never get a Liberal to admit that on the record, but fine, let them put a good reason on the record, because the research on the EI sick benefit is in, the politics are favorable to getting it done, the circumstances make it as urgent as any of the reforms in this bill, and yet it continues not to be done. It is incredibly frustrating to see the government pass up yet another opportunity to make this simple and urgent change to the employment insurance regime, Madam Speaker. Another thing that really ought to be here, Madam Speaker, as we approach the end of the tax year, is a low-income Serb repayment amnesty. We know that right now the government is asking a lot of people to pay back their Serb payments who don't have the money because they were living in poverty before the pandemic. They were told in good faith, sometimes they were told by representatives of the federal government itself, including some members in the chamber. Sometimes they were told by administrators at the provincial level that they should be applying for Serb. We know in Manitoba that happened in some cases with kids graduating out of care. These are people who were told by people in various positions of authority that they ought to go ahead and apply for Serb, and they did. And they were supported for a time, and that money is spent. Didn't get shunted off into a tax haven. It wasn't spent on international, shares in some kind of multinational company. It was spent here in the local economy, supporting people who live on the margins and face some of the most economically difficult challenges as anyone in the country, and they don't have the money to pay it back, Madam Speaker. So let's not kid ourselves that somehow there's a big wad of cash out there and all the government has to do is demand it from the poor and it's going to help the bottom line. The fact of the matter is that money isn't there. And the only thing that the government is going to accomplish by insisting on getting that money back is making it even harder for folks who are already struggling with poverty to get back on their feet. And I don't see what the benefit is. I don't think there's any justice in that. And I don't think there's any financial or economic benefit to Canadians out of that, frankly. Certainly not in the short term. And I'd argue that in the long term, we're actually making it more difficult for people to get back up on their feet and to contribute in what ways they can to the economy. And that doesn't benefit us, and it ends up costing us more in the long run. And we don't see any mention of that here, Madam Speaker. I think it's a real disappointment, and again, fails to seize upon a really urgent issue as we near the end of the tax year and the deadline that so many have been told they have to meet in order to make those repayments that they quite clearly can't afford to make. So I want to use the time I have left to talk just about two more issues. One is the Canada Recovery Sickness Benefit, or the sick days, the 10 sick days. Now, I spoke a little bit about that. I think I've made it clear, Madam Speaker, we're of the view that those should be legislated, and they should be a matter of right for every Canadian worker, regardless of whether they have a collective agreement or not, regardless of whether they have a generous employer or not, regardless of whether they work in a federally or provincially regulated workplace. Canada should be able to get to the point where every worker is entitled to 10 paid sick days, whatever the reason, whether it's COVID-19 or something else. But in this time, it's imperative that people be able to call in sick to work. That's why we push so hard to try and get 10 sick days. And so we have this program. It's seen less uptake than was projected. And part of that is because people can't take their sick days one day at a time. And so as people wake up with some symptoms and don't want to go into work on pain of infecting their colleagues, they decide maybe they're going to take a day off work. But they have to miss, not only can they not take it a day at a time, they have to miss at least 2.5 days or 50% of their normal work time in a week in order to be able to take the benefit. So, if they go to take that day and their test comes back rather quickly, they could be back at work before they qualify for the sick time, in which case we haven't helped them at all to take time off work in order to protect the public health of their colleagues and their communities. And so that means people may well make the choice. They can't afford to have a test result come back the next day, because then they'd have to go back to work and then they'd have had a day that they didn't get paid for. And if they're only getting by as it is, you can't afford to do that too many times before you find yourself in financial difficulty. So it's important that people be able to take it one day at a time. We know that some people are making more than $100 a day, but they still need all of what they make in order to be able to make their bills work at the end of the month. And that's true even for people who aren't living extravagantly, Madam Speaker. And so this isn't a program that offers full wage replacement in the way that employers who are required to give sick days as a matter of law to their employees would be expected to provide full wage replacement. And so we continue to have these deficiencies in the program. We're missing an opportunity to try and address those deficiencies. We're only addressing the one, which was that it was left wide open for non-essential travelers to claim it. So, good to be fixing one problem, but really missing an opportunity to get to the real meat of the issue that's preventing this program from being the success we need it to be in order to protect public health and in order for it to be a proper stepping stone to those 10 days of paid sick leave that New Democrats believe every worker should be entitled to, pandemic or not. Now, the other thing that's harder to address in legislation, but I think this is a moment to ask if there is any legislative barriers or issues that are leading to this problem, is the fact that there are many Canadians, we've been hearing about them, I've written the government about this, it's come up in question period, the issue of people who have exhausted all of their EI regular benefits. So those are the benefits that we're extending up to 50 weeks now, but still have open claims that would allow them to claim, for instance, a sickness benefit or another kind of EI special benefit. And because that claim is open and they can't close it without losing those potential benefit weeks, they're being told by the CRA they can't get the Canada Recovery Benefit. Go talk to Service Canada. They go talk to Service Canada. Service Canada says, well, your regular benefits are exhausted, so that should be enough for you to be able to apply for the benefit with the CRA. So they go back to the CRA. The CRA says, well, your claim is still open, so you got to talk to Service Canada. And finally, Madam Speaker, they just get fed up of being bounced around, and they call their MP. This isn't the way to be helping people in an emergency. They need access to these benefits, and it's up to government to sort it out. If there's a problem with the fact that the CRA doesn't understand that people can have exhausted their regular benefits and not want to close a claim in case they get sick and they can access the sickness benefit, or in case they want to use other kinds of EI special benefits, this is something that government should be able to figure out on its own. It shouldn't be up to individual Canadians who are facing financial crisis to spend days, weeks, or months running around chasing different people in departments, getting their MP involved, trying to figure out how they can get access to what is supposed to be an emergency benefit in difficult times. Give me a break. So what we need is some political leadership for sure. And if there's some kind of legislative change that needs to be made in order to end this infuriating problem that Canadians are facing, now's the time to do it. Let's get it done because the need is urgent. So let's make it simple. Thank you very much, Madam Speaker. I look forward to questions and comments.
Questions and comments. The Honourable Member for Aurora, Oak Ridges, Richmond Hill.
Thank
Thank you very much, Madam Speaker. And thank you to my honorable colleague for a very comprehensive overview of some of the real opportunities but challenges within the current employment insurance system. And of course, the emergency benefits that with the Serb that were put in place to address some of those things. What he didn't touch on in terms of reform around the employment insurance program is regarding contract workers. We saw that there were mechanisms for Serb, but the EI program doesn't really address people who are precariously employed and contract workers. And yet we found, certainly in the pandemic, that they were in need of that kind of insurance backstop. I'm wondering if he could give us any thoughts on what or how, or if that's an aspect that EI should be looking at addressing. Thank you.
The Honourable Member for Elmwood-Transcona.
Well, thank you very much to the member for raising this long-standing problem with the employment insurance system, which is that it doesn't recognize that more and more, and we can debate the reasons and the virtues, people in the Canadian workforce and in the global workforce more generally aren't working the kind of 9-to-5 jobs of the past. And we don't have an employment insurance system that recognizes that. I mean, I think one of the big solutions that's been put on the table, I know a conservative colleague of hers was quick to try and shoot it down earlier based on, I think, some misleading claims about how a guaranteed annual income might be funded and how it might be rolled out. But I mean, one of the ways that people are talking about addressing this issue is moving towards some kind of guaranteed annual income system. It would do a lot for many marginalized people, including people living with disabilities and seniors who have inadequate pension income. But it would also do a lot for Canadians that are participating whenever they can in a workforce that doesn't provide a lot of steady employment in the way that we're used to thinking of it as a 9-to-5 kind of 40-hour-a-week job, and that would help them take more risks. I mean, we've heard from advocates of guaranteed annual income some of the benefits to entrepreneurialism that exist when people know that within a certain limit they can try and fail without losing their shirt. And so, I mean, I think that's one of the directions that we need to be looking at quite seriously as we move into the future, to make sure that we have an income support program that can capture everyone, and so that we're not continually having the kinds of debates that we've been having all through the pandemic about all the different people who are falling through the cracks and really do need that assistance, and how we would all be better off if they got that assistance, because they're going to spend that money here in the local economy. And I think that's the direction we need to be looking at. Thank you.
The Honourable Parliamentary Secretary to the President of the Queen's Privy Council.
Yes, thank you, Madam Speaker. And, you know, I often listen to New Democratic members of Parliament provide comment in terms of that how government's just not doing enough, that we need to do more in every aspect of society, it would seem. And my question to him is that, you know, I suspect that some of these so-called permanent changes that he's advocating for would even have been that much more difficult in terms of passage in the House of Commons today. I would at least speculate as a possibility, and maybe he can provide some comment on regards to that. But my question to him is more, we have had, NDP administration in the province of Manitoba, as the member knows, for 15 plus years in the last 20 or so years. And a lot of the changes that he is advocating for need to be put in place provincially to cover a larger percentage of the workforce. Why does he believe that the provincial governments in the past 20 years in Manitoba have let down our workers to the degree in which they have?
Member for Elmwood-Transcona.
Well, it's a good question. I mean, no government is perfect, of course. I've long maintained that the NDP government of Manitoba under Dewar and then under Selinger ought to have passed anti-scab legislation. It was a disappointment to me that they didn't, and I look forward to a future NDP government in Manitoba doing that here, just as one example. And likewise on paid sick days, I'd like to see us get it there. But I do think it's better off when we can get there as a country, because let's not pretend that Canadian provinces don't compete for investment, and it would be better if we were to do this all together. And I think there's been a moment in the pandemic where with appropriate federal leadership, we could have tried to move to a position where provinces were all instituting 10 legislated sick days at a time to prevent that kind of interprovincial competition that too often gets in the way of progress for workers in any one particular jurisdiction. So it was a real disappointment to me to see the federal government take a pass on that. Now, in respect of other measures, making it more difficult for this law to pass quickly, I frankly disagree. In fact, a majority of the House of Commons and then a unanimous House of Commons called for a 50-week EI sickness benefit. So there is no reason to think at all that changing the number in the legislation from 15 to 50 would have caused one iota of delay in respect of this legislation. It's a very simple change. It's been called for by the House unanimously, and I can't fathom why it's not in here.
The honourable member for South Okanagan West Kootenay.
Well, thank you, Madam Speaker. And I just want to thank my colleague from Elmwood Transcona for a really great speech that I think outlined a lot of the really important things that we should have learned during this pandemic, that we should be looking ahead to the future, not just within the pandemic. And, you know, he just talked about the government not putting the 50-week period for EI sickness in this legislation, about bringing forth a paid sick leave benefit that is very, very difficult to use and not useful. When we're in a pandemic, we want people who are sick to be able to stay home and not risk the lives of them and others. So I'm just wondering if he can expand on that, and perhaps he has some idea why the government has gone against the will of the House of Commons, why it has gone against its own election campaign promises and not brought in these measures.
Honourable member for Elmwood Transcona.
Well, thank you very much for that question. I'd like to take the opportunity, if I could, to talk just a little bit about the folks that I've been hearing from across the country who are experiencing long COVID, and there's a lot of, I mean, this isn't unique to Canada. It's happening all over the world, where people who have appeared to have recovered from their COVID infection then get different kinds of recurring symptoms, and they can be quite debilitating. They're not very predictable. They get in the way of people holding down a job. In some other countries, they're starting to begin work. They're assembling professionals into clinics together to try and get a better handle on this condition, to understand better how it works, but also to legitimize the condition so it can be recognized by insurance companies, for instance, who have also been resisting recognition of this. The EI sick benefit right now is the best way to be able to accommodate these folks and make sure that their new novel and debilitating condition doesn't become the cause of their financial ruin. And as I say, I mean, I am mystified as to why that's not in here, given the widespread political support that measure already enjoys in the House of Commons.
The honourable member for Nanaimo Ladysmith.
Well, thank you, Madam Speaker, and I'd like to thank the honourable member from Elmwood for his speech. It was very, very comprehensive, and I agree with so many of his points, especially that this was a time when we could have been working on some permanent programs rather than this continued patchwork that we're dealing with. And so many people have fallen through the cracks during COVID-19, so many businesses as well. And I'm really happy to see the NDP and some Liberal members who are supporting guaranteed livable income now. This is something that we've been promoting with the Green Party since 2006. And economic studies show that it will actually increase employment and increase economic activity. And I think that it makes for a great sickness benefit program as well. If it's done properly, you have a system available so when people don't work, they still get their check. And I just wondered if the honourable member would comment on some of these things.
Honourable member for Elmwood Transcona, 30 seconds.
Sure. I mean, I look at all the debates that we've had in the House over the last year or so, and you think about when we talk about Serb and all of the constituencies that we've been trying to help. I mean, whether it's workers who are trying to get their access to their sub plan, whether it's moms who are struggling to access benefits for maternity, whether it's seniors who couldn't handle the additional costs of the pandemic, people living with disabilities, all the people falling through the cracks could have been captured by a more universal approach of the kind that we were advocating for early in the pandemic. And all the time that has been spent trying to close those cracks and not comprehensively, like we haven't succeeded, could have been spent fixing other problems.